So, let's start discussing about conjunctival melanoma. The incidence is about 2% of all ocular malignancies. Now, melanoma histologically, if you see, there is a proliferation of the melanocytes in the epithelial layer as well as in the subepithelial stroma. So, it's invaded the stroma. That is important. Primary acquired melanosis is at the level of epithelium. This is at the level of subepithelial stroma. So, melanoma can arise from three things. One, most of the cases, 75% will arise from primary acquired melanosis with cellular atypia. Second, about 20% of the case will arise from a pre-existing nevus. And primary melanomas are least common variety. How does a melanoma will present to you? A conjunctival melanoma. Age group mostly in the 6th decade of life. You will see a black or a grey nodule at the limbus with the feeder vessels, and it is fixed to the underlying episclera. This cannot be moved. So a dark nodule with the feeder vessels fixed to episclera, mostly at the limbus. It can be of amelanotic variety, where you will see a fish flesh appearance like nodule, a pinkish nodule at the limbus. So this is how it is seen clinically. You see a nodule, feeder vessels, and it cannot be moved. How you treat? If it is circumscribed lesion, go for excision with a wide clearance followed by cryotherapy. Send the specimen for biopsy or histological examination. If you find that the lesion is involved in the depth, then once the conjunctival lesion has healed, radiotherapy can be done. Radiotherapy is done in a melanoma with strontium applicator or ruthenium plaque. If melanoma is involving the caruncle area, we can do a proton beam irradiation. So this is when on histological section you find that it has involved deep, it has gone deep, the tumor has gone deep. But if there is a diffuse spread, superficial diffuse spread, in that case, excision will be followed by, once the conjunctival lesion has healed, then it is followed by topical chemotherapy or mitomycin C. This is about a circumscribed lesion. If the lesion is diffuse, so diffuse melanoma, so melanoma will have nodules. So what you do is excise the local nodules, and for the rest diffuse part, give topical chemotherapy or mitomycin C. Okay, so circumscribed part and diffuse part. Third is, if there is an orbital recurrence, again local resection and radiotherapy. If there is lymphatic spread, excision and radiotherapy. And in metastatic disease, again you have to do radiotherapy or chemotherapy. Okay, so how a circumscribed lesion, a diffuse lesion, an orbital recurrence, a lymphatic spread. Okay, so now what is the prognosis? In about, if you see the mortality rate in 5 years, it is 12%, and 10-year 25%. There's some poor prognostic factors. 1. Multifocal tumor. Second, the thickness of the tumor is more than 2 mm. Uncommon locations like involvement of the caruncle or the fornices. orbital or spread or lymphatic spread, and recurrences are seen. Okay. Now the metastasis, when it occurs, it is usually the regional lymph node, liver, lung, and the brain. What is the differential diagnosis for melanoma? So you will have a large nevus and a ciliary body melanoma having extraocular invasion. Okay, thank you.